please feel free to use the chat box and the Q&A function and put your questions in there. We will definitely have a dedicated time to answer questions at the end of the presentation. Additionally, I wanted to let you all know that we will be conducting a couple of polls to understand your experiences and just also make this presentation more participatory with you all. Again, I want to repeat, bienvenidos a los que están aquí que quieren escuchar en español. Por favor, elija su idioma Spanish. Ustedes pueden oprimir el botón marcado Interpretation. El globo está en la parte abajo de la pantalla. Seleccione Spanish. Okay, so I'd like to introduce the president of the Children's Partnership, Mayra Alvarez, to kick us off. Thank you.
Thank you, Gabriela. And thank you everyone for joining us this evening. We know how busy these days are and we appreciate you being with us. Many of you are joining us via Zoom and some of you are joining us via Facebook. So whichever form that you're connecting with us, again, thank you for the time and for the attention to this important conversation this evening. I want to just give a heads up that throughout the presentation today, we want to value your time and your input. So we will have important opportunities to solicit some of that input through some polls. In between our speakers, we're going to ask some questions about telehealth, about health in the time of COVID. And we really appreciate your responses because that helps us better understand how we can better serve you in our policy work and in our partnerships with our community partners. So with that, I'm just going to get us started. So I want to start by really thanking our partners that are with us this evening. Of course, our main partner in this webinar series, Pique, for their incredible work with families across California and for working with us on this important webinar series, to Vista Community Clinic, to Altamed and Dr. Ilan Shapiro for being with us this evening. We are grateful, and of course to the entire Children's Partnership team for working so hard to get this going. So during these challenging times, we at the Children's Partnership are working with our partners to offer families peace of mind when it comes to caring for their children's health and their children's well-being. We know that all medical care for kids is essential, including well-child visits, immunizations, and access to specialty care. That's why we're using this evening's discussion to share with families how to care for your child's health while we're living in this pandemic. It's important to know that many healthcare offices remain open with additional safety measures in place, and many others are offering telehealth appointments when appropriate, giving families access to experts directly from your home. For parents, telehealth, what we'll talk about tonight, virtual healthcare, it's a game changer because it makes healthcare more accessible and even sometimes more affordable. Thanks to modern technology, it's all over the place, right? Websites and apps on the software side of things, but also smartphones, tablets, desktops, and medical devices on the hardware side. Telehealth makes it possible for many of us to connect with a provider anytime, anywhere. It gives doctors, and you'll hear about this tonight, the ability to look in a child's ear or inspect an itchy rash, or you can talk to your own therapist, all from the comfort of your home. Yes, with no need to schedule an office visit or even get in the car, this virtual care, telehealth, it really is changing people's lives. But what's important to note is that it's not the case for everyone. In a recent joint survey with the Education Trust West, 94% of parents surveyed said they would like to access their child's doctor using telehealth. But sadly, only 18% said that they're currently able to do that via telehealth. And this is especially a problem when we know how important health is for our families. In fact, health was the #1 concern among parents, according to a survey conducted by Pique just at the beginning of the pandemic. We understand that many parents and families are new to telehealth. So tonight, we've prepared this webinar to respond to some of the most frequently asked questions that we've been hearing from you all, to give parents peace of mind, and most important, to help you prepare for your child's important health appointments, hopefully via telehealth. So before we jump into these important presentations, let's launch our first poll. The first question is, what issues are you facing that impact your or your child's physical, mental, or dental health? If we have any providers with us, please feel free to respond based on the people that you serve. We're very interested in hearing what you've been hearing as you work with your patients. Great, thank you. So let's get started. I'm honored to be joined by a great group of panelists this evening to share information on telehealth, how it's used, and how families can know their rights to care in a virtual setting. To kick us off, I am honored to introduce Stephanie Thornton, Policy Associate at the Children's Partnership. Stephanie originally joined our team as the Peter Harbage Health Policy Fellow in 2019. We're excited that she's now officially a TCP Policy Associate, championing health coverage and care. And in this role, she supports projects specifically related to oral health, immigrant child health, mental health, and serves as our key person on telehealth. And I hand it over to Stephanie.
Thank you so much, Myra, and hi, everyone. We really appreciate you all taking time to join us today to learn more about telehealth. As Myra just spoke about, we're here to answer some of the most common questions that we've been hearing about telehealth. I'd like to get us started with some of the key terms. Telehealth is a way to deliver healthcare using technology like phones, computers, and tablets to exchange health information virtually between patients and providers. There are two kinds of telehealth that I'll talk about over the next few moments. The first being synchronous telehealth, which refers to live two-way telehealth. And that's when patients and providers are communicating in real time, like on a video call or over the phone. The second form of telehealth is called asynchronous telehealth, and that refers to telehealth that is not happening live. That's the transfer of health information like data, messages, photographs, and other communications from patients to providers or providers to patients to then be reviewed at a different time. Sometimes this is called store and forward telehealth. A good example of this is what Myra just alluded to with sharing a picture of a rash. I can take a photo and upload it using a secure electronic portal to send to my doctor to look at and then write me back. Next slide, please. So telehealth is a tool that's designed to help you connect with providers, and that includes doctors, nurses, therapists, dentists, and many other healthcare professionals over video, over phone, and in other virtual ways. With telehealth, you can have an appointment with a provider from your home or from other safe, comfortable locations. And as Myra just mentioned, we know that there's a gap in who can access telehealth right now. But what we really want to share with all of you is that telehealth is for everyone, and we all need to make sure that it can be accessed by everyone. New guidelines are designed to make telehealth more accessible, especially in the era of COVID-19, and even easier to use with technological innovation. Next slide, please. Why use telehealth? As mentioned, the COVID-19 pandemic has really highlighted the importance of telehealth as a tool that can be used to keep both patients and healthcare providers safe. It became even more important and even more popular to ensure that families and all individuals could still get the needed care that they need in this time without having to travel to clinics, offices, or hospitals. But even before COVID-19, telehealth has always provided many benefits for families. Next slide, please. Besides social distancing, some of the other important benefits of telehealth include the ease of access. There's less time and money spent on transportation when virtual appointments can happen from your home. It's also convenient. Many families have shared that it's really been a game changer, as Myra talked about, in not needing to request as much time off of work or miss as much school to have appointments virtually. And third, research has shown that telehealth is a really useful care coordination tool. It's helpful to connect different providers to patients and ensure that when more complex health questions arise, children can get referred to specialists and follow up when needed. Next slide, please. So here's some examples of what the different kinds of telehealth might look like. On the right, this image here shows what would be called a synchronous telehealth visit, a live video visit between a provider and a patient. On the left, this is a representation of how store and forward telehealth can work. Whereas in an in-person visit in a clinic, perhaps you filled out your health information, the medications that you or your child are currently taking, and any reasons that brought you to the appointment on paper on a clipboard. Instead, it's filled out on a computer and sent to the provider to then review and communicate with you about the questions. Important note that your information is still protected under the same healthcare privacy laws when you have a telehealth appointment. Everything is kept confidential, and it's just like a regular appointment when it comes to privacy laws. Next slide, please. Asking for a telehealth appointment. So you can always call your community clinic or your child's provider and ask if they're offering telehealth visits for kids right now. Especially since COVID-19, many health plans, providers, and Medi-Cal have increased their telehealth offerings and have communicated via mailers, emails, and other bulletins about how telehealth appointments are currently working. When you schedule an appointment, you should receive all the information that you need for logging on or any instructions for maybe a mobile application or a link to click at the time. But you can also ask if there's a staff member that could call you ahead of time to make sure that your device and your connection works for your appointment. Some providers are offering mental health, dental, and other kinds of visits virtually right now. So you can always ask what kind of visits you or your child can access virtually. Next slide, please. Can I use telehealth in Spanish? Yes, absolutely. Many providers are fluent or have staff members within their clinic that can meet with families over telehealth right now. And you can always ask the clinic or office if they have staff who speak Spanish that can join appointments. An important note that interpretation and translation services are covered under Medi-Cal. You can request to have interpretation services for an appointment in advance at no cost to you or your family. And some patients have shared that it has been pretty easy to have an interpreter join a telehealth appointment, especially one that happens over video, because it can be just like a 3-person Zoom or a video call with another person there to serve as an interpreter. Next slide, please. Where can you learn more about telehealth? We're super excited to share this resource of frequently asked questions about telehealth and kids. You'll receive a downloadable version, and it will also be up at our All-In website that includes a summary of the information I just shared, as well as the key phone numbers and website links for learning more about telehealth and how you can access telehealth care in California. Next slide. And in addition, the Children's Partnership website and the All-In for Health websites have all sorts of really important resources around health coverage, around the census, COVID-19 specific resources, and many more that we really encourage all of you to take a look at, download, print, however is most helpful to you. And I will hand it back to Myra.
Thank you, Stephanie. So now we're going to hand it over to our next poll for folks to respond to. Would you like to have an appointment with your child's doctor using telehealth, either using your phone or computer? And the next poll question is, have you had a medical or a health visit with your child's doctor using telehealth, again, either through phone or computer, since January of 2020? Trying to better understand how many of you have had the opportunity to utilize telehealth. Great. Thank you all. Next slide, please. Now we have the opportunity to hear a little bit more about telehealth in practice. Stephanie did a great job of providing an overview of what telehealth is, its different forms, how patients can get involved, what sort of questions may come up for you. Now we have the opportunity to learn a little bit more about what it actually looks like in a clinic setting. We have the opportunity to hear from Crystal Avila. Crystal has worked as a care coordinator at VCC Lake Elsinore Community Smiles as part of the virtual dental home program for 2 years and is a wellness advocate dedicated to quality patient care and oral health education. Thank you for being with us, Crystal. I'll hand it over to you.
Thank you so much. So I'm going to talk a little bit about the program Virtual Dental Home, or VDH, as I'm going to be using frequently. It's a pre-COVID model, of course. The program provides preventative, non-invasive dental care to Medi-Cal patients ages 0 to 20. The services may include anything from an exam, x-rays, a dental cleaning, sealants, and fluoride that are all performed by a registered dental hygienist. All the x-rays and the photos are then reviewed by a VCC dentist from our VCC Lake Elsinore office. From the office, they will then create a treatment plan based on the information received. This is the virtual component. Where can I receive VDH services? The VDH model is intended to take place in a community setting. We were fortunate enough to continue our partnership with Lake Elsinore Unified School District, which currently hosts our mobile dental van. VDH puts preventative dental care on autopilot and streamlines children in need of dental work straight into our office for treatment or referrals as needed. This saves families time and money from taking multiple days off school or work for routine care. It also allows me, the care coordinator, to track the progress of the child and address accordingly. Some of the program goals include patient education regarding preventative dental care specifically targeted toward ages 0 to 5, early and regular dental checkups to eliminate fear of the dentist, hopefully as soon as the child turns 1. And this really emphasizes that prevention and care are the key to a lifelong healthy mouth, and regular dental visits really emphasize this. Next slide, please. COVID-19 has affected people worldwide, and this has forced many dental offices to close their doors, leaving many patients without access to dental care. With dental disease being the #1 chronic condition in children, this has left many families vulnerable. So we've started incorporating telehealth dental visits into VCC Lake Elsinore, and we have been busy at work providing telehealth and in-person emergency visits to both medical and dental patients during closures in order to reduce burden on emergency rooms and urgent cares. Emergency dental patients are offered telehealth visits over the phone or through Zoom with a dentist. Pictures may be sent prior to the appointment for the dentist to review. The dentist will then assess the emergency to offer appointments, referrals, and extractions as needed. This protects both patients and employees from, by limiting person-to-person exposure. On June 29th, after 3 months of limited services, we were able to reopen our dental doors for non-aerosol producing services, including exams, x-rays, sealants, fluoride varnish, and emergency extractions. VCC Lake Elsinore is also providing limited in-person appointments for dental exams, medical appointments, labs, immunizations, and chiropractic visits. Next slide, please. How to keep a mouth healthy for life. COVID-19 dental closures allowed me to create an oral health curriculum, which was then condensed into the infographic as pictured. To distribute this information, I created an oral health presentation targeted towards kids and parents. This presentation includes a live brush along segment, a nutrition education component, a flossing demonstration, and education for parents on the different stages of cavities paired with the infographic, which really emphasizes all the information. From there, I started doing phone education. Once the visual components were complete, I began outreach and called families with children at high risk of dental decay, patients due for exams, and prenatal patients. By checking in on the families and asking about their oral health, I was also able to ask about if anyone was experiencing dental pain in the home or was in need of any other VCC services, and I was able to help them out accordingly. By keeping in touch with these vulnerable families, I was able to assist with their other needs, such as medical appointments and enrollment assistance. Not only building, but maintaining relationships with our families and letting them know that VCC is here to serve the community and assist with their health needs. At the height of COVID-19 closures, some of these calls just involved conversations with parents that let me know what was going on, that were really struggling with some of the quarantining. Next slide, please. Families choosing health. These measures have helped families get back to routine care. By bringing their kids into dental, they were able to start scheduling other needed appointments for the whole family. By working with the community, thanks to our wonderful relationship with LAUSD, we were able to communicate with families in need of immunizations, physicals, and dental appointments to get kids back in school and families back to their routine care. We do our best to ensure that all of our clients' care and safety. And due to the current pandemic, there was a lot of concern about bringing loved ones into the clinic for their routine health care. Through patient outreach, I was able to inform families that VCC is taking the utmost precautions to ensure the safety of everyone. The precautions include the option for telehealth visits, which is very important, clinic sanitation every 30 minutes, a mandatory mask requirement upon entry, and a heavy screening and temperature procedure prior to entering the clinic. We really try to strive for excellent customer service, and VCC is a one-stop shop for your wellness needs, including family practice, pediatric health, women's health, mental health, prenatal services, teen physicals, enrollment, and insurance assistance, chiropractic visits, and dental services. Patients are our priority, and we are constantly trying to improve the quality of our services, especially in these uncertain times. Thank you so much.
Thank you, Crystal. Appreciate your presentation. Before we transition, we have one more poll. If you have had problems accessing telehealth, what are the reasons? There are many that can come up. And again, if you're a provider, feel free to respond based on what you have heard from your patients. Great, thank you. So again, thank you, Crystal, for that important overview of Community Smiles and the virtual dental home. Something that you said really stuck with me, the fact that, COVID is disrupting our lives, but that's not an excuse to make sure that we're not still establishing or continuing healthy habits that are going to impact our well-being and the well-being of our kids for a lifetime. That it's important to have the habits now to create a lifelong healthy mouth or a healthy mind or a healthy body. And so I am thrilled and honored to be joined tonight to talk about telehealth and what families need to know about taking care of our health and our children's health during this time by Dr. Ilan Shapiro. Dr. Ilan Shapiro is the Medical Director of Health Education and Wellness for a federally qualified health clinic at AltaMed. In addition to being a practicing physician, Dr. Shapiro is actively involved in creating binational public health programs to reach Latino communities on both sides of the border. He acted as a medical advisor for the General Consulate of Mexico in Chicago and was a member of the editorial board for A Tu Salud, For Your Health, a health bulletin representing Hispanic health topics and resources. Dr. Shapiro is part of the National Hispanic Medical Association and the spokesperson for the American Academy of Pediatrics. But what's not in his bio is that Dr. Shapiro is an incredible champion for the health of our communities, not only serving families directly in a clinic setting, but also right in the community. In fact, before the pandemic, I saw him at multiple community events, a community health fair down in Orange County. It's just more evidence of how much heart he puts into his work. And tonight is another example of that. So thank you for being with us, Dr. Shapiro. We get to jump into conversation together.
Mayra, it's a pleasure right now. And, one of the things that we know right now is that everything is changing, that the things about routines and the way that we saw life and felt life and the way that our kids actually learn at school, it's completely gone. And right now it's quite important, right, to establish this conversation because I can tell you the truth. There's people that hate technology, but right now, telehealth is a game changer. And I hope after this conversation and the future, it stays and we can actually make it better.
Absolutely. I could not agree with you more. So before we jump into that, I'm a big believer, and a lot of us are, that we bring our whole selves to this work. And each of us is living in this pandemic as well as we're trying to be in this webinar. So I just want to start with, how are you holding up in this time? I know you've got little ones too, and you're working really hard for the community. Dr. Shapiro, how are you holding up in this time?
Well, Maya, I'm going to tell you the truth. At the beginning, it was hard because the routines were destroyed, and I have never felt. I have never been a soldier, a police officer, or anything like that. It was the first time that I left my home every day thinking that I was representing healthcare providers and health, and I was a soldier in the front line, and the stress of being able to come back, and not only come back, I always want to come back, but to bring back, the coronavirus to my family, it created a lot of interesting things. Then one of the things that I started doing, and actually I'm very grateful with my wife, was that I started exercising more. The way that we eat, the way that I was eating, I always kind of take care of myself, but right now I was actually very, very, taking care of no papitas, no other stuff, the la botanita, the other stuff, I was putting it aside, and most importantly, making sure that I was sleeping and to be present with the family, because sometimes right now with all of us, we're going out there, we're essential workers, no matter what we do, there's a lot of stress, and we can bring it home. And at the moment that we bring it home, we start hurting our partners, kids, and that's something that changed a lot.
I mean, I'm nodding vigorously with you because yes, absolutely to all of that, the disruption but also the ability to try to be present because, you know, we're here all the time, right? So yes, so thank you for sharing that. One of the things that I want to talk to you about, because we've heard from many people, just what it's doing to our mental health, being at home all day, not, you know, for our kids, not socializing in the same way, right? Their school year was disrupted. Perhaps their summer camp schedule was disrupted. They're not having the same interactions as we are. Plus, you know, the COVID is impacting many of our communities, particularly the Latino community. It's getting hit hardest. And then we're also reckoning with police violence on many of our communities. Black and brown communities are being attacked in many cities across this country, including Los Angeles. So we've heard a lot from families, Dr. Shapiro, about the importance of mental health in this time. And in thinking about the families that you talk to and the parents, what should parents be looking out for in this time? And where can there be room for concern?
The first part of it is making sure that we as family members, as parents, we're in our own wavelength. Because if we become anxious and depressed or more antsy-pantsy, and the thing that happens, you know, like we're in a lot of stress, there's economical hardship right now. There's like questions regarding jobs and everything is changing. Then we as parents or family members, we're already stressed a lot. Then we need to make a safety check for us, first of all.
Yes.
It starts with us, making sure that we become a little bit more resilient. There's no way that this is normal. There's no way that I can tell you that I have the pill or the vaccine or the special app that will make us better. I would love to, but I don't have it. I have little tricks. One of the tricks is making sure that you're eating well, trying to sleep well, making sure that one of the things that is very important is that even though that we are social distancing and at home, that doesn't mean that we're actually attached to the couch or a chair. That we need to move with our children. Then the things that you need to be watching with your kids, making sure that a couple of things that when you start seeing your kid that is eating a lot or not eating, you know, as he used to, that's like a red flag. Like something is changing. A couple of things, you know, like when they are like doing a lot of, you know, movement or becoming very hyperactive, or the other way around, they're just not leaving their bedroom or their place. The things that they used to love, they are not liking. It could be from video games to just like walking out or like just painting, like little small things that we can see as family members that something is weird and changing. Then when you start adding up all these things and, you know, like lack of sleep, change of routines, there's a lot of red flags there. And one of the things that you need to do is just ask and ask, you know, how are you doing? And create those moments for mental health and resiliency for yourself and your family. One of the things that I love doing, Mayra, is like at the end of the day, the only thing that my therapy with my family is the next one. We're sitting down and make sure that I try to be present. You know, cell phones, electronics, screens, everything is put aside. And when we're sitting down at dinner, we ask for 3 things that you like from the day. So like, what are you grateful for? And I will tell you at the end why this exercise is important. And then, you know, you start talking and you go one by one. And at the end, you go like, one thing that you would like to change, you know, something bad that happened and how will you resolve it? And this is very important because I'm Hispano, I'm Mexican, and we are very tough as parents and we do everything perfect and we don't have any problems. But at the moment, share with your kids what's happening and the way that, you know, that yes, you had like most of everything good, but there was something that was not that good, but you found a way to fix it.
Mm-hmm.
It's an amazing tool for your kids because you start opening the door like, you know what, Dad, you know, it's cool about coronavirus, but I have been 6 months here and I miss my friends. I hate this. And you start having conversations that, you know, but you need to create a framework around this. It's tough, yes, but at least you're opening the door to be there.
Absolutely. I love that. And I love that you are creating the space for your family to have those types of conversations and be comfortable. That's amazing. And I think you're giving us good ideas on what we could do to create those spaces at home too. But one thing, you know, connecting it to telehealth and this conversation around telehealth, is there options for mental health services via telehealth? And what does that look like for families?
Mayra, coronavirus brought a lot of horrible things, but it brought like a lot of innovation to our communities. And let me tell you why. All this stuff, and I can tell you the journey of Altame that we, you know, like in a matter of 2 weeks, we actually implemented 2 years of technology. Then
Wow.
we moved from like only like being in the clinic and looking at the patient, you know, side by side and very close contact to actually meeting the patient wherever they needed us. And with mental health was the same thing, and it's beautiful because we had a lot of patients that they would love to bring their kids to us, but you know there's something called work, and if I miss work, there's no food. If there's no food, there's no family. Then you know a lot of people were like, you know what, you know I will put this thing about mental health and depression and anxiety and all this stuff on the side, and I will make sure that you know at least there will be food. Then we're always on survival mode. But right now with telehealth and with mental health and teledentistry, um, there's no excuse.
Yeah.
There's no problems with transportation. There's no problem with leaving work. We can actually make sure that we create a spot on the day that our kids will be taken care of or ourselves. Because this is, you know, we're talking about kids, but this actually goes to the entire family to make sure that we are actually in tune with everything else. And that's one of the most exciting things. We started actually a mental health program around telehealth. And it's awesome because, you know, people love it. You know, it's not for everybody. There's people that go like, I actually need to see, touch, and be present with something. And right now with COVID, it's kind of iffy. But at least right now, people are like finding a room in the house or a moment in the daytime, and sometimes they do it in the park, and they get to talk with a therapist. And this is, you know, at least it's something that we've never had before, at least in the communities that I serve.
That's incredible. That's incredible. I'm going to take this moment to emphasize for those of you that want to listen in Spanish. Si quieren escuchar esta presentación en español, por favor, oprima el botón que tiene un globo y selecciona Spanish y puede escuchar esta presentación en español. Gracias por estar con nosotros.
I have a question from Jasmine Correa regarding like phone calls and stuff like that. I know that telehealth is not perfect. There's a lot of kinks on you know, like when we're working and the telephone and the 8100 number and stuff like that.
Sure.
It will probably get better in the future, but right now, from not having it to having it, I will never go back to the old model for sure.
It's a really good point in what you said about trying to make healthcare more accessible, right? Because healthcare is ours. It's for us to take care of ourselves and our families. And I love what you said about now it's everywhere. You in those 2 weeks, you guys changed the world when it comes to connecting virtually. And I think hopefully conversations like this will help many more families also change their own worlds in order to focus on health and well-being. Because one thing that has raised some concerns for us, Dr. Shapiro, is what we've heard about the drop in well child visits because of the pandemic, the drop in vaccinations, a 40% drop compared to the same month last year. That means kids that are at the very important stages of development aren't getting the care that they need. And we know that this care is essential. And I just want to be honest, families are pulled in a million directions, right? Like parents are trying to work, or they're going to work, or they're also being teachers. Like how, when it comes to their children's health, what should parents prioritize during this time?
Mayra, first of all, I'm a father and a pediatrician and a doctor, and it's amazing that what we heard at the beginning. First, we told them, do not leave your house. Yeah. You need to be at social distancing. Don't even put your nose out of the door because you will explode and you have COVID all over. And we heard that message. But right now, we know that, there's certain things regarding diabetes, vaccinations, you mentioned it, well childs, and other stuff that we need to go to the doctor. I would love to tell you that I can send like via FedEx or Amazon, the shots, and like take it tomorrow, and your kids will hate you. Right now, the things that we actually can do is that we are making sure as pediatricians and physicians and clinics that to create, if we were already taking care of the spaces, we make sure that, if there's anything from telehealth that we can take care of you, yes, let's do it. Let's take care of that. And we actually, in CHLA, that it's part of the Ultimate Family, we the Children's Hospital here in Los Angeles, there's actually a vaccine clinic. And what do I mean with this? That it's a drive-through. Then you do a lot of other things on the phone, and you end up going there. Then we're creating a lot of innovation to respond to the needs of our community. But there's a lot of well child visits. I'm part of the American Academy of Pediatrics. We still recommend completely if your kid is like newborn and you need all these well child visits to make sure that the development is fine. And I would love to do it by phone, but I need to touch them and make sure that I'm measuring them and weight them and like do stuff with my hands with a stethoscope on their heart. Maybe in a couple of years, everything that I'm telling you, Mayra, will be thing, and it will be like a thing that go like right now I actually need to do them, and especially for example, we check for anemia, we check for lead.
Right.
There's a lot of things. Then the thing for me as a parent and as a pediatrician is that I make sure that vaccines are on top of the list, and let me tell you why. Right now we're fighting one pandemic. We're fighting the COVID-19, and it's horrible. We do not want to crack our boat. The thing that every time a kid doesn't have a shot, we make a little hole on that structure of a boat. Then water starts coming in, and it will get to a point that a lot of people will start like having measles and mumps and more whooping cough. I practiced in Mexico for a couple of years, and I saw the devastating effects of diseases that are preventable by vaccine from kids that were not having access to a lot of things. Then I can tell you for sure, Mayra, that this is a critical moment that we do not want to walk back all the years of doing the good mention of technology, the good mention of vaccines, and the safety of them. And this is a moment to go back and Mayra, don't get me wrong, call your pediatrician, call your doctor, and tell them, and ask them straightforward, like, what are you doing to protect my child? And they will tell you all the amazing measures that we're doing, from like the different parking lots, the things you come and we do screening before. And at least for me, when I come in, there's a thermometer waiting for me. There's a screener, and the same thing for me, for all the stuff that we have, our entire team, and the same thing for family members, patients, and of course, the parents.
Yes, absolutely. Well, I'm trying to be a good example, and I have a checkup on Tuesday. So I answered all my questions, and I'm got my mask ready. So I'm with you on that. I think it's definitely important to make sure we're taking care of ourselves. But you talked about safety, and I appreciate that you all are thinking about all the protocols to put in place so that people feel comfortable, because there are some mixed messages. Stay home, but go to the doctor. But so making sure that people know that it is safe and that you're putting all those in place is particularly important. But I want to dig a little bit on safety when it comes to telehealth, because many people have this worry that where is their information going, and privacy, and how does it play out with telehealth? What can you tell families? Like, is telehealth technology safe and secure? Stephanie touched on this a little bit, but curious your thoughts and what you can share.
Gladly, Mayra, and you raise an interesting point, because every time that we use something electronic or a phone or something like that, or even anywhere that we have a computer, there's a possibility of something going wrong. Right now, at least the technology that we're using, it's HIPAA compliant, it's encrypted. That means that it's very, sometimes it's very, very hard to tap into the information, or to try to listen or hear or manage or manipulate any information that the doctor is having with the patient. And we're making sure that continues to be hard. And we, of course, we hear about a lot of things, but right now, at least from the past 6 months, I haven't heard an office or a system or a hospital that has had problems with telehealth. The important thing about telehealth is I'm more worried about the safety of the conversation, because especially with underserved communities, with communities of color, there's this idea that there's something that we call the internet divide, that the online difference
For
between
sure.
people that understand technology or not. But in reality, I have not seen that. I actually feel my pediatrician used to come to my house when I was young, and he will bring the vaccines. Yeah, and it was awesome. And for the first time, I feel that I'm going inside of the family, yeah, actually inside of the home, and seeing how the grandma, la abuelita, is on the background, and the kid is actually smiling because when they come to my office, they are like, no, VP. They know about vaccines and stuff like that. And but right now, it's different. They are there, and I'm seeing the interaction with the kids. I'm seeing the house. I see the social dynamics. Then there's a lot of closeness, and for the first time, and it's happening a lot, that I'm actually feel closer to a lot of my patients that I used to, because I'm actually, I now understand, what's happening in the spaces, everything. Then personally, I am seeing a lot of, there's a curve of education, and even for physicians, trust me, it's not normal to go like, I believe you, I'm not touching you or hearing you, but like, then it's a trust builder, and I'm telling you that I'm spending more time talking and hearing instead of just like typing and doing other stuff that is not patient related.
Oh, that's incredible, Dr. Shapiro, because that's exactly what we want, right? When we talk to our doctors, our providers, we want to feel like that we have a trusted relationship, that it is a relationship that's going to last a while, and that you will be able to work with us over the years, especially as our kids grow up. We want to make sure that our pediatrician knows our child and can, point things out. So that's really special. I hadn't thought about, you are literally going to people's homes, right? You're sitting with them in their living room or sitting with them at their kitchen table. So that's a really beautiful concept of what telehealth can do to build connections. I think another important connection that telehealth builds, and Stephanie touched on this in her presentation, is the importance of translation, right? And connecting with providers that speak their language. But I want to talk a little bit deeper about that. We know that half of the 9 million kids in California are part of an immigrant family. We know that about 40% of all of our state's residents speak a language other than English. And we know that the most effective treatment depends on good communication between the doctor and the patient. So what are your thoughts on translation and telehealth? Obviously you speak more than English, right? You speak Spanish, but what is it like when it comes to translating services via telehealth? And what should families know about their rights when it comes to using telehealth and translation?
They have full rights of, especially, I work with a federal qualified health center. Then it's our duty to actually present and share information in their language that they will understand. It sounds very easy, but we have an army behind it to make sure that the documents that we give, the educational material that we give, and actually the interaction with the physician, it's in a language that they feel comfortable with. And we there's like plugins where someone like Jennifer will be translating from one side to another, and we have even like some type of iPads that have like special stuff. Then you have the iPad, it's connected to the video. Then there's a lot of things that you can request, and make sure, please, Mayra, this is very important for anybody. If you're with a doctor, even if they speak your own language and you're not understanding something, just go like, doc, that doesn't work. It's like, no. And I always give this example, and they laugh a lot, but this is completely true. That this is my philosophy. I'm a servant. I'm a waiter. Then when they come to me, I need to make sure that they know the menu, and they start. And the same thing with telehealth. This is the most important thing. They need to understand what they want. Like if they want to eat Mexican or Thai or vegan or whatever, they at least need to know what they want. And I will present the menu and tell them, this is what I recommend. If they want to choose other dishes with me, that's okay because they are choosing for them. But at least they know that there's other items on the menu that will help them. That this is key for everybody. And and you're right, this information needs to be translated to a language that they understand. And sometimes it's the same language, but it's not culturally appropriate.
Absolutely.
And,
Well, to your point, even sometimes the English language in healthcare terms is just sort of over our heads. And knowing that we have the opportunity to ask questions and dig a little bit deeper in order to better understand the care that is happening. So I appreciate that for sure. Okay, so we're wrapping up on time, which is crazy to believe because it flies by. I know. So I want to in this final question before we jump into questions, because there's already a few coming at us. Parents and caregivers are holding so much right now. Think about it. I mean, you've got a global pandemic that is hitting many of our communities super hard. You have a crushing economy that is particularly detrimental to families with children. And you have these ongoing challenges of systemic racism, all while trying to be the best parents that they can be. So for the parents that are on tonight, and actually for all of us, you know, Dr. Shapiro, you're one of the most positive and inspiring people that we work with. What do you want to make sure families walk away with tonight?
you're not alone. There will be horrible days, horrible nights. There will be issues at work. You probably will come back home and you thought that you were going to bring $1, but it's actually 25 cents. You're not alone. There's people like Mayra, like the Child Partnership, like Altamed, like everybody that Elsinore. Like you have a lot of people in front of you that actually we're here for you, and our only mission in life is to be there for you and for your family. Then, if you need help, there's always someone. And sometimes as parents, we feel that we are the last standing soldier on the line, and that's not true. There's a team behind you.
That's right.
You're not alone, and your kids are not alone. Then make sure that even though that the only constant right now in life is change, that you seek for help. And you need to, maybe it's a comadre or a compadre, like a friend, a family member, a priest by phone, someone, but it's very important that you take care of you to take care of everybody else. And there's always something more to do.
Thank you, Dr. Shapiro, for this incredible conversation and for the work that you do in our communities day in and day out. Thank you. So we're going to transition over to the Q&A portion. So please stay with us. And I know Stephanie and Crystal are with us as well. I know it's going to be a helpful Q&A portion. But before we transition to Q&A, we have two final polls for those of you that are with us. I'm sorry, we have three final polls, quick polls. If we can pull those up, please, and we can get those going. First poll is, have you had a well child visit for your child since the beginning of the pandemic? Next poll. If you have used telehealth, how would you rate the experience? No pressure if it was with Dr. Shapiro. And then the final poll question, and we'll jump into Q&A for a few minutes. In the future, whenever possible, I would like the option for a telehealth visit. Do you agree with that statement? Yes or no? Okay, so let's jump into questions. I saw one that you've already started, so if our panelists can come back to us. Somebody asks about piloting telehealth programs. Michael asks about piloting telehealth programs in a school district. You know, thinking about the fact that many families have challenges with access to healthcare and transportation, and why schools are so much more than learning centers, right? They really are community centers. This is a topic near and dear to the heart of the Children's Partnership. So let's talk a little bit about piloting the program at a school district. I'm going to start with Stephanie. Stephanie, you want to share some thoughts on whether there are programs piloting at school districts in California?
Sure, thanks, Myra, and thank you for the question. As Myra mentioned, telehealth at schools is something really important to the Children's Partnership, and I think you know, the virtual dental home program that Crystal shared is one of the most successful pilots in California that has reached so many kids at school sites. That being said, there's tremendous room for growth, especially in California. We do know that there are other states that have really invested far more in increasing the telehealth presence at schools. And that's something that, you know, we think about in the policy conversations that the Children's Partnership is lucky enough to be part of, about how we can push to adopt some of those more successful models that have been tried in states like North Carolina and Georgia that do have more kids able to access telehealth at their schools. But I'll pass it over to Crystal if there's any, you know, particular highlights or standouts that you'd like to share from the virtual dental homes work at schools, because that is really such a bright spot for reaching kids in California.
Thank you so much. Yes, Virtual Dental Home has been a really great program. I was able to help kick it off at VCC Lake Elsinore. It's just been a great way to get a lot of kids, especially younger kids, into established dental care and then streamline them into treatment, as I mentioned earlier. So the goal is that we focus on prevention, but we treat the problems. And we educate as much as we can. So it's been a really great experience, and we hope to continue with it and pair it along with our mobile dental unit, which is currently within LAUSD, that does provide screenings, visual dental screenings for everyone regardless of insurance status.
Thank you. There's another question about platforms and which platforms are best to use. Victoria asks, which telehealth platforms do you use, Dr. Shapiro, at Altamed? Or are there certain ones that are recommended for confidentiality? Can you speak to that a little bit to clarify for folks?
I love the question because at the beginning it was practically FaceTime, and that was you know, like, yeah, that was our go-to, but that doesn't mean that it's HIPAA-proof, encrypted, or anything like that. A lot of people actually started with, for example, with WhatsApp, that is actually encrypted, but you have the a certain technology stuff. Then I'm starting to go from like the stuff that we already had, like to create like in emergency situation some type of conversation, and going up. The other one is actually a couple of free accessible things. It's called Doximity and Doxime. Then those are both platforms that are free for providers that, you know, that they're HIPAA proof, encrypted, very safe, very easy to use. And those are there. And after that, the one that we end up using is we use an EHR that already has like that platform, and you have like the app that you can download as a patient, and you can actually just connect via that to your provider, and it's completely secure. It talks to the EHR, and I'm debating if I need to call out the name, but it doesn't matter. It actually, like at least the other two are free, Doximi and Doximi.me. They're completely free and you can actually have access for them.
Great, thank you. On the flip side of that, do the patients have to be concerned with anything on their side for the technology? Do they have to have a certain app? Stephanie mentioned that just to check in with the provider, but does that matter for privacy and confidentiality?
It really doesn't, and I'm going to just show you the free app that I was telling you about. It actually practically, I can call you right now like this. It will send you a link. You click on it. It's encrypted. Then I can actually start right now with Mayra, with any of you, and then the forum link in like 3 or 5 seconds, having an encrypted conversation with you that it's safe. And secure for them. Then it's always important to ask your doctor what platform that you're using, stuff like that. The problem that I have seen is that a lot of the data plans that we have in the community are not that high. And sometimes when you connect, or they're very slow, or the data, you finish the data plan and you get disconnected. Then those are kind of more the logistical stuff that we have. But in general terms, I have not had any major disaster yet.
Got it. Okay, that's helpful. That's helpful. One thing that has come up time and time again, and this builds on Michael's question about schools, is schools were so much more for families than just learning. And I don't want to say just learning, but more than learning and being in the classroom. They really are, spaces for socialization for children. They're spaces for safety for many children, food access. How do schools utilize technology now to connect families to different services? Stephanie, I know you've talked about this many times over these last few months, thinking about our school partners. Can you talk a little bit about what beyond direct healthcare services are schools using technology for?
Absolutely. I think, as Myra mentioned, the bridge to other necessary support services is such a critical role that schools play. And, I really am so in awe of the school champions that are continuing to serve as that bridge, even when not seeing students and parents in face-to-face settings, including navigation to food banks and providing tremendous resources at school lunch pickups. That's a place where we've seen information about healthcare and about, even some dental screenings are starting to pop-up temps at drive-by school lunch pickups that schools are hosting, as well as, providing resources around mental health for children and families, around COVID testing sites, information, resources about what happens when someone in the family contracts COVID, and really so much more to make sure that, even with the digital divide, as Dr. Shapiro spoke about, and ensuring that kids can access Wi-Fi and devices when they're available, to help with so much more on top of learning.
Definitely. And actually, a question came in about coronavirus, and knowing that many families have different family members that are recovering at home with coronavirus. How do they learn about protocols during, how to care for themselves, after? Like where would they learn that? Is that through telehealth, or are there other resources to learn about coronavirus and what to do to make sure that the information is in the hands of people that need it the most? Dr. Shapiro, I'll start with you.
On reality, it's a combination of many things. I think that everything finishes in telehealth, because that's the best way. If you don't need to go out and you feel sick, why have the hassle? And if you're not having shortness of breath, you're not dehydrated. They can, even though that we are very used to see the doctor put the stethoscope on top of us, but with me as watching all the 4 people that I have in front of me, Jennifer, Stephanie, Crystal, and Maria, I can tell a lot of things just for seeing and talking with you, then, we can extract a lot of information from telehealth, but they can get information from the CDC website. It's awesome. I love that, for example, the WHO, the World Health Organization website. It's awesome. They have multiple languages. The American Academy of Pediatrics has actually a patient portal. It's called healthychildren.org, and it's awesome too. And you have also the Children's Partnership has amazing resources. Ultimate has amazing resources, and worst case scenario, you just call 411, not 911. 411, and they can actually help you with a lot of resources out there in the community, from food resources to clinics to a lot of things that you can have access to.
Absolutely. And also our state website, right? I think it's covid19.ca.gov. There's information there in multiple languages, so you can make sure to access that information as well through the state, the latest and greatest. All right, I have a question for Crystal, specifically for Vista Community Clinic. Alejandra is interested in, is there a program in Oceanside for a school in Oceanside like the one in Lake Elsinore?
My apologies, I was just typing that out. So currently, I don't believe we have the VDH program running in Oceanside. We do have, however, just opened a new site called Mission Dental that is a pediatric dental office, and that just recently opened in Oceanside. We also have a second mobile unit that does visit school districts, I believe, in Oceanside and Vista.
Great, thank you. So I have another question, is related to the fact that, actually, Dr. Shapiro, you mentioned 411. Do you mean 211? 211, 211, 211. 411 is old school, right? Back in the day, we used to use 411, not anymore. You're sharing our age now, Dr. Shapiro.
Yeah, I'm hiding right now for whoever is just hearing us. I'm just hiding here in the corner of the, yes, like that. Yeah, but yes.
Yes, 211. It's a great information line with a tremendous amount of resources related to COVID, or as well as a number of other questions that people may have. So another question I think that's come up in our communications with our partners has been the issue of technology overload. Right? We are on technology all the time now, and it's with classes, it's with work, it's with communication with our families, right? We're doing Zoom calls. Should we be concerned with screen time? What is that during this time, Dr. Shapiro? Should we really be worried about that right now? Help put some of the families at ease about screen time and what's happening.
It has changed a lot the way that we perceive, and understanding that, the important thing is to have communication, and having TV just for the sake of TV and being the new technologically advanced babysitter, it doesn't work out for everybody. Actually, it doesn't work for anybody. And we know right now that the longer we stay in front of a TV without actually having a conversation or stuff like that, and even if it's like a educational program, if you don't have that interaction with someone else, your brain doesn't get it, and you're like just entertaining and killing time. That's it. Then it's very important to make sure that I'm a strong advocate of creating routines. And routines are basic for this, because, schools are being hybrid, and most of us right now, we're telecommuting at school, right? They're watching everything through the screen and that stuff. Then you need to make sure that you're balancing all this stuff. And I don't call that a screen time. I just call it schooling. But when they're off, we need to make sure that they are moving at least 1 hour a day. And sometimes it's impossible to go out and, to the woods and run in open spaces, but make sure that you're doing some type of exercise with them. And I love, for example, there's a couple of YouTube videos for kids that, they have like good stuff that you do it as a parent with them, and you have fun. It's your time to do exercise. It's time for them to do exercise. And at least you're using, like, schooling and technology on a positive way and a fun way. For example, with video games and stuff like that, I try to refrain them for doing those. I going to confess something. I'm an advocate for Pokemon Go. I actually have fun with my kids. It's interactive. They can fight with other family members all over, and you can actually walk. If you don't walk and move around, you just don't advance. And it's a nice way to actually use technology in a platform that actually makes gaming a fun and a healthy way to use it. And there's a way to convert like from the bad, I'm not moving, my brain is actually melting, to actually I'm moving and doing exercise and doing social stuff.
Absolutely. Absolutely. It's funny, wearing my First Five hat, there's so much that parents can do, particularly with young kids, where their brains are in that stage that they're absorbing all of this information. And it's so important, talking to kids, reading to them, and singing to them. They don't care that we don't have good voices, right? What matters is that we sing, and that process is educating our children. So give yourself some credit, parents. You're doing amazing in being who you are, and laughing with your kids every day. Okay, I'm so sorry, but that is all the time that we have for questions. We are strapped for time, but I just want to say huge thanks to Stephanie, Crystal, and Dr. Shapiro for lending your time and your expertise, and to Jennifer for interpreting tonight's discussion to ensure that we are talking to our community members. And of course, to our partners in this webinar series, Pique, Vista Community Clinic, Altamed. This isn't possible without you. And to all of you tonight, whether again via Zoom or via Facebook, we are on these platforms all day, and we are incredibly grateful to have you with us. Before we go, I want to say I hope all of you stay healthy, and that you please remember to participate in the census. We're just a few weeks out from the deadline of the census. If we're thinking about our health and our well-being, the census and the numbers that are collected through that census are directly connected to the resources in our communities. So make sure you participate and get counted, and that you count your kids in the census. If you have any questions, please reach out to, I'm sure, any of us on this webinar tonight, to ensure that we are counting every single one of our family members. And then I will also say, November 3rd is less than about 60 days away. It's an important election this year. Make sure you get out and vote via mail. Make sure we're staying safe, or take the necessary precautions to vote in person on November 3rd. Those are both two actions, the census and voting, that are essential to our health. Again, thank you for being with us. We are so excited that you were part of this conversation, and we look forward to continuing to work together for the health and well-being of all of our California families. Buenas noches.